Welcome to the channel, Nurse Master. HELIS test is related to detection of options A. Urine protein, B. Urine ketone bodies, C. Urine bile salts, D. Urine bile pigments. The answer is option A. Urine protein. HELIS test is a biochemical test performed to detect proteins in biological fluids including urine. The therapeutic position advice for pelvic inflammatory disease. The options are A. Semi-Fowler's position, B. Sims position, C. Lithotomy position, D. Trendelenburg position.
The answer is option A, semi-Fowler position.
Pelvic inflammatory disease is an infection of the female reproductive organ. Patient should be placed in semi-Fowler's position to relieve pain and preventing abscess formation in the abdomen. Kahn reaction test is used to assess. The options are A. Syphilis, B. Gonorrhea, C. Meningitis, D. Diphtheria. The answer is option A. Syphilis. Which of the following disease is due to deficiency of vitamin D? The options are A. Querciaca, B. Marasmus, C. Rickets, D. Beriberi. The answer is option C. Rickets. Rickets is due to lack of vitamin D. Rickets is the condition of softening and weakening of bones in children. Temporary paralysis of intestinal wall. The options are A. Erb's paralysis, B. Monoplegia, C. Paralytic ileus, D. Bell's palsy. The answer is option C. Paralytic ileus. Paralytic ileus is the inability of the intestines to conduct peristalsis, which can lead to obstruction. It is the common form of non-mechanical obstruction. Paralytical ileus occur after surgery but can also occur due to an inflammatory response, electrolyte abnormality, thoracic or lumbar spine fractures. Erb's paralysis. The group of nerves around the shoulder is known as brachial plexus. Loss of movement or weakness in the arm can occur when these nerves are damaged. This injury is known as neonatal brachial plexus paralysis or Erb's palsy. The nutrient which is preferred to repair tissue. The option are A. Fat, B. Protein, C. Carbohydrate, D. Minerals. The answer is option B. Protein. Excessive amount of liquor amni in uterus during pregnancy. The options are A. Oligohydramnios, B. Polyhydramnios, C. Ploidactylus, D. Ahydramnios. The answer is option B. Polyhydramnios. Polyhydramnios is condition where amniotic fluid exceeds 1.5 to 2 liter in volume. Normal amniotic fluid level, 500 ml at 18 weeks, 800 ml at 34 weeks, 600 ml at term. Junction between two or more bones or cartilages. The options are A. Synovial joint, B. Sutures, C. Joint, D. Fontanelle. The correct answer is option C. Joint. Liver stores glucose in the form of. The options are A. Carbohydrate, B. Glycogenate, C. Glycogen, D. Glycodine. The correct answer is option C. Glycogen. Assessment of neonate is by The options are A. Bishop scoring, B. Apgar scoring, C. Partograph, D. Stress test. The answer is option B. Apgar scoring. The Apgar score is a quick test performed on a baby at 1 and 5 minutes after birth. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score tells the healthcare provider how well the baby is doing outside the mother's womb. The Apgar score measures 5 things to check a baby's health. 1. Appearance, skin color. 2. Pulse, heart rate. 3. Grimace response, reflexes. 4. Activity, muscle tone. 5. Respiration, breathing rate and effort. Minimum score is 0 and maximum score is 10.